I am Dr. Cassius Camden Clay. I invite you to be a member of our Strong Club. Members of our club use a unique system of quick self-fix techniques that wake up weak sleeping muscles and immediately make them strong. Most people, even world-class athletes, have a significant number of muscles that test weak. Olympic athletes, large muscle bodybuilders, they all test weak. If you are not a member of our Strong Club, you probably have a lot of muscles that will test weak also. These muscles are not weak because you need more exercise. These muscles are most often weak because of connective tissue tightness and joint fixations that are disrupting blood flow, lymphatic flow, and/or nerve conduction that is necessary for muscle strength. These muscles have gone dormant to conserve resources. They are hibernating like a bear in the winter, sleeping to conserve. I'm going to teach you how to wake these weak muscles up and make them instantly strong and keep them strong. The standard belief that the only way to make weak muscles strong is by exercising is false. We now know that we can make significant weak muscles instantly strong and keep them strong using specific connective tissue stretches and joint motions that we do to ourselves, the quick self-fixes. The connective tissues that we focus on stretching include ligaments, tendons, and fascia. They are a complex network of intertwined layers of Spider-Man strong spiderweb-like tissues interweaving themselves in a matrix that connects and holds everything in the body together. Finding weak muscles and making them strong is most valuable because of the following reasons. It increases vitality. It improves physical and athletic performance. It helps prevent injury and helps heal existing injuries. It helps resolve pain and increases overall comfort. It helps slow the development of arthritis, and it burns fat. Hibernating muscles do not burn as much fat as active muscles. Think about it. For the past 8 years, I've practiced Aikido, a Japanese martial art, at the Roswell Budokan near Atlanta, Georgia. I get up in the morning around 5 a.m. a couple times a week for this martial arts practice. I can't use caffeine to wake me up because it messes with my heart rhythm. So instead of caffeine, I do my 20-minute quick self-fixes routine. Afterwards, I feel awake, alert, energized, and excited about exercise. I perform better in my martial arts practice because my previously chronically weak muscles are activated and strong. Furthermore, I used to get injured a lot. Now injuries are rare. When I do get injured, I am normally capable of resolving my injuries fast using quick self-fixes. This prevents small injuries from morphing into big ones. Regarding comfort, anytime my patients complain of muscle tension, it's almost always associated with muscle weakness. The portion of the muscle that is strong is being overworked and fatigued to compensate for the adjacent muscle weakness. One form of arthritis is due to bone growth in the wrong places caused by stress on the bones. So when muscles that support joints are chronically weak, those joints move in dysfunctional ways and stress the bones, causing increased arthritis. Quick self-fixes support joints with strong muscles and reduce bone stress, thereby slowing the development of arthritis. How did I develop quick self-fixes? In 1979, I learned that weak muscles instantly became strong when the correct chiropractic adjustment was applied. This proved to me that chiropractic worked. Weak muscles became instantly strong, and I really liked that. For the past 20 years, I've intensely studied assisted yoga postures from Thai massage. I've taught well over 200 one-day assisted yoga workshops, and I've written a book on my very best assisted yoga postures. I have a very deep hands-on understanding of the functions and dysfunctions of connective tissue. About 14 years ago, I discovered that almost any weak muscle that I could make strong with a chiropractic adjustment, I could also make strong with an assisted yoga stretch. This is a revolutionary concept. Numerous times I've witnessed abnormal spinal curves called scoliosis significantly improve or resolve completely as a result of connective tissue stretching with assisted yoga, and without the chiropractic adjustment, which was my previous standard treatment for scoliosis. I surmise that the chiropractic adjustment is actually a stretching technique that uses the body's bones as levers to stretch other connective tissues. One of my services in the martial arts community is treating people on the martial arts mat for free. Henceforth, I was motivated to treat them only once for free. I discovered ways to teach my martial arts friends how to emulate my treatments so they could make and keep their own weak muscles strong and heal. Henceforth, quick cell fixes were born. Originally, they were developed to resolve injury and pain. Later, the quick cell fixes evolved into a well-choreographed routine for creating and maintaining overall muscle strength. I invite you to join our Strong Club by learning the quick cell fixes routine and practicing it daily. I'm teaching you how to be strong, not how to treat symptoms. We focus on our strength and our good health to be well. Do all the quick fixes together to help you be strong and heal. You may choose to only learn the quick cell fixes for yourself, or you may choose to learn both the quick cell fixes and the associated muscle testing to amaze, educate, and help others. Do not do quick cell fixes on other people, only perform them on yourself according to our guidelines for safety reasons. Learning quick cell fixes and associated muscle tests from a DVD and book is like learning yoga from a DVD and book. It does not replace a live teacher. We invite you to attend our quick cell fixes and muscle testing workshops for better competency. Please come to us or bring us to you. This is a new profession. If you find this technology amazing and you are compelled, you are welcome to apply to join our team of certified quick cell fixes practitioners and workshop leaders. We are taking quick cell fixes and muscle testing worldwide. Contact us at www.quickselffixes.com or call 404-808-4280.
My name is Daryl Stafford, and I have been a competitive bodybuilder for 25 years. I started off as an amateur and worked my way up to a national competitor.
There's a group of 3 muscles that I'm going to test together because they share common quick fixes. So first we're going to test rectus femoris. Keep this foot straight, lift it straight up, 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 up. If this was 90 degrees, that you're going to come down to about, let your leg down to about 80. You're going to hold there. I'm going to stabilize you on the other hip. Hold strong. I'm going to push down. He doesn't have his initial strength there. Rest down. Now I'm going to test your psoas muscle. Lift this leg up. There's 90 degrees. I'm coming down to about 80. Down, maybe down a little bit more. About 70. Bring the leg out a little bit. Let your leg out a little bit. Turn your foot out. I'm going to push this foot down that way, and I'm going to brace you on this side. Hold strong there. And he doesn't have the initial strength there. When the leg comes up that high, it tests the belly of the psoas. That's where it's weak. Rest down. Next comes the test for tensor fascia lata posterior division, the belly of. You're going to turn your foot in, bring your leg out a little bit. I'm going to push this foot toward this foot. You try and stop me. Hold strong. No initial strength. When those muscles go weak, commonly they go weak together when the hip is fixated and or the ankle is fixated. So it might be one or both. Henceforth, we just treat both, okay? The ankle fix comes first. Sit down right here again for me. The talus bone, which is right here, gets fixated. And the fix for that is you just shake it and the fixation comes free, but you have to shake it like you mean it. And shake it loose, let the foot be real loose, loose, that's perfect, good. And now, lay back down for a minute. The quick cell fix-it for a fixated hip joint is a kick. It's not a knee snap kick, it's a jacking your hip joint up and kicking down to free up the femur head from the acetabular cup. That fix makes those 3 muscles strong. So stand up. You can touch me for balance, that you have to kind of lean to the side so you don't kick the floor, and give it a nice firm kick. Yep. Perfect. Lift this leg up, straight leg up, and now we're testing rectus femoris. Straight head, hold strong. Initial strength is intact, hold strong. Core strength, now hold super strong. And now Daryl has his sustained strength with that muscle. Good. Now psoas. Lift this leg up, foot turned out, and hold strong, initial strength, hold strong, core strength, hold strong. Look at that. I'm powering in and I'm not going to beat him. That is back. Tensor fascia lata posterior belly. Foot turns in. I'm pushing this foot toward that foot. Hold strong, initial strength, hold strong, core strength, hold strong again. He's got his power. People often think that using quick self-fixes with more than a gentle force results in a better outcome. It is quite the opposite. Using the quick self-fixes with more than a gentle force may cause harm. I have conclusively proven that performing gentle quick self-fixes make and keep targeted chronically weak muscles strong. This is the quick self-fix series for the foot, leg, and thigh. First is the Soleus Fix. The soleus muscle is just behind the tibia bone. The tibia bone is right here. The soleus muscle is just behind it. It's also just in front of the gastrocnemius muscles, which are right back here. The soleus muscle and the gastrocnemius muscles join to form the Achilles tendon, which is right here. The upper part of the soleus muscle commonly feels soft, but the bottom 1/3 of the soleus muscle is often way too tight. When the soleus is too tight, it pulls on the Achilles tendon, which causes and contributes to Achilles tendonitis pain. It also pulls on the heel bone, which in turn pulls on the plantar fascia under your foot, contributing to plantar fasciitis pain. My primary treatment to prevent and treat Achilles tendonitis and/or plantar fasciitis is a deep soleus massage regularly. If your lower soleus muscle is very tight and/or significantly painful to massage, spend an extra 15 minutes a day massaging where it is too tight, perhaps while watching TV. It is okay if the soleus massage is reasonably uncomfortable to perform. However, stay within your acceptable pain threshold. We start thumb on thumb, the bottom 1/3 of the soleus muscle just behind the tibia bone. Massage deeply up and down for the count of 5. 1, 2, 3, 4, 5. Move down several inches. Same thing, just behind the bone, pushing in deep, thumb on thumb, better pressure. 1, 2, 3, 4, 5. Further down the leg. Move the muscle by flexing the foot up and down. 1, 2, 3, 4, 5. Move the thumbs down several inches. Push in super deep. Flex that foot back and forth. 1, 2, 3, 4, 5. This moves the muscle underneath the bone for a muscle massage. Last spot, closer to the ankle. Thumb on thumb, just behind the tibia bone, in deep. 1, 2, 3, 4, 5. And this concludes the Soleus Fix. Next is our foot fix. This fix releases fixations in bones that help make the arch of the foot. The first metatarsal, the first cuneiform, and the navicular bone. The foot fix makes gluteus medius muscle instantly strong, and it also helps relieve tension in the soleus muscle. The fix is a resounding slap fix to each joint, just like this, with a flat hand just like that. Now we have the ankle fix. The talus bone, which is right here, articulates with the tibia above and the calcaneus or heel bone below. It often needs a little help in finding its optimal position. The ankle fix immediately makes strong psoas muscle that runs deep along the spine and inserts into the femur, and the rectus femoris, one of the quadriceps muscles, and the tensor fascia lata muscle, whose tendon inserts into the IT band. If the ankle motion during this fix hurts anywhere, stop and do not do this fix. Start with a very relaxed, loose ankle, very loose. Hold the lower leg just above the ankle with both hands and give a sudden rapid foot shake, just like this for about 2 seconds. 1, 2. This miraculously aligns the talus and makes psoas, rectus femoris, and tensor fasciatus strong. The knee fix corrects fixations between the femur bone and the tibia bone. Together, both this fix and the meniscus fix that follows the knee fix instantly make popliteus muscle and peroneus tertius muscle strong. The popliteus muscle crosses behind the knee. A weak popliteus muscle contributes to knee instability. The peroneus tertius muscle comes off of the bottom 1/3 of the fibula and has a tendon which crosses lateral to the ankle. When the peroneus tertius is weak, it causes ankle instability and increases the potential for ankle sprains. The knee fix is gently applied. Take the thumb side of the same side arm and wedge just under your knee, snug behind your knee. The other hand contacts above the ankle, and it's a 1, 2, 3 traction set. It's gently done. It's also done laying down if you like. 1, 2, 3 traction set. Here is the meniscus fix. The menisci are 2 C-shaped cartilages that cushion your knee joint between the femur bone and the tibia bone. They often get fixated. The meniscus fix, together with the knee fix, immediately make popliteus and peroneus tertius muscles strong. This is the meniscus fix. Find the hinge joint between the femur and the tibia bone. Take the meaty portion of your hand just under your thumb on each hand and firmly wedge it into the hinge on each side, contacting the menisci. It's 1, 2, 3, kick. This is also performed comfortably laying down. 1, 2, 3, kick. Now we have the iliotibial band fix. The iliotibial band, also known as the IT band, is a thick connective tissue band running down the side of the thigh. When the IT band is tight, it causes weakness in tensor fasciatus muscle, gluteus medius muscle, and quadratus lumborum muscle. This fix makes instantly strong all 3 muscles. Lay on your back. Cross a leg over your body, tractioning the leg slightly downward, and begin pounding the iliotibial band with strength and force. Be sure that the hand is coming up pretty high in order to have space to build speed. Do this for 10 to 15 seconds, all the way down, close to the knee, and all the way up, actually crossing the hip, pounding on the tensor fasciatus muscle. Here is the hip fix. The hip is a ball and socket joint and is often fixated. The hip fix makes tensor fasciatus muscle strong, rectus femoris muscle strong, and psoas muscle strong. The emphasis is on kicking to mobilize your hip, not to straighten your knee. Certainly your knee does go straight, yet it is a soft and smooth straightening of the knee joint. Pull your hip up towards your head with your knee bent and kick gently, yet with intention, just like this. One more time. Pull that hip way, way, way up and kick. Some fixes are master fixes and correct muscle weakness in seemingly unrelated muscles anywhere in the body. When other targeted quick cell fixes fail, master fixes often save the day by making these weak muscles instantly strong. The master fixes include the large intestine fix, the liver fix, and to be taught later, the occipital glide fix and the connective tissue strap routine. Here is the large intestine fix. Somewhere around half of the body's lymph nodes line the large intestine, also known as the colon. The large intestine massage makes weak muscles strong by stimulating overall lymphatic drainage, including lymphatic cleansing of muscles. Do not massage areas of your abdomen that are painful to the touch. Consult with your gastroenterologist if you discover painful areas in your abdomen. This large intestine massage moves in the direction of fecal movement from right to left. Always massage through a relaxed abdomen by laying on your back with your knees up, keeping your feet down. If your legs are down flat like this, the abdominal muscles are tight and it's difficult to penetrate. When the knees are up and the feet are down, the abdominal muscles relax, leaving way for better and deeper penetration. Start by finding your navel with one hand and the right front of the pelvic bone with the other hand. Trace to the middle of a diagonal line between these 2 points. With flat fingertips of both hands, hand over hand, press in firmly and massage gently in small clockwise circles over the ileocecal valve. The ileocecal valve, which is right here, is the valve between the large and small intestine. Continue massaging up the right side of your abdomen's ascending colon to just under the liver and pause and spend a little extra time massaging at the hepatic flexure to also stimulate the gallbladder below the liver. Turn left where the transverse colon begins and the ascending colon ends. Travel 1/5 of the way toward the left just under the ribs. Skip over the middle 3/5 of your transverse colon. We skip most of the transverse colon to avoid contacting a major artery called the abdominal aorta. Some abdominal aortas have thinly ballooned out walls called aneurysms that can rupture, causing death. Continue on the left, just under the left rib cage, at the splenic flexure under the spleen, and then continue down the left side of the abdomen over the descending colon, ending to the far left of where you started at the ileocecal valve. Next is the latissimus dorsi fix. This is not a master fix. The latissimus dorsi fix strengthens 2 latissimus dorsi muscles. There are 2 reflex points that are located on the front of the rib cage just under the pectoralis major muscles, in line with the nipples, and sometimes to either side of that line. Search for tender points in this general area, stay within your acceptable pain threshold, and massage these spots for up to 10 seconds. This completes the latissimus dorsi fix. The latissimus dorsi fix also makes the lower trapezius muscle instantly strong. The liver fix is a master fix, and it also specifically makes the pectoralis major muscle strong and the middle trapezius muscle strong. The liver is our most important organ of detoxification. This fix manually vibrates the liver to stimulate activity. Lie on your back and bring your knees up and feet down. Place one hand under your right rib cage using firm pressure, pushing up and under the bottom of your right rib cage. This holds the liver stationary and in place. With an open hand, gently tap from a 6-inch range in a rhythmic series with an open hand. Ribs are fragile and can break. Do not hit hard on the ribs. Be gentle. Do not do this if you have osteoporosis or osteopenia. The following fixes focus on stabilizing the pelvis. The first fix is the transverse abdominal fix. It is commonly found weak when tested. Exercising the transverse abdominal muscles, which run horizontally across the abdomen but do not cross the midline, is a relatively unknown exercise, yet is the most important abdominal exercise. The transverse abdominal muscles are part of a corset which stabilize your low back and pelvis while walking. First is the Kegel exercise, which is pulling your pelvic floor tight by tightening as if cutting off urine flow in midstream. Second is pulling your transverse abdominal muscles together toward the midline by pulling your pelvis up off the table. Be careful when coming up that you're not pulling with your arms. Your hands are merely being a mobile pillow keeping your neck safe from stress. So first we Kegel, pull the pelvic floor tight. Next we pull our transverse abdominal muscles toward the midline on either side by rocking our pelvis up, and then do a traditional abdominal exercise for rectus abdominal, pulling straight up. So there's Kegel, pelvic floor tight, rock sacrum up by pulling transverse abdominals together, and then up we go. Next, we go to the side for the internal oblique muscles and the external oblique muscles. Kegel, pull your transverse abs together by rocking your pelvis up and go to the side. Kegel, pull transverse abdominal muscles together by rocking the pelvis up and go to the side. Now we do the other side. Kegel, pull transverse abdominals together by rocking the sacrum up and go to the other side. Kegel, pull transverse abdominals together and go to the other side. And now rest. You may work up to 15 in this plane, 15 in this plane, 15 in this plane, or more. Only do this exercise if there is no pain. Here is the hamstring warm-up stretch. The hamstrings are right here on the back of your thigh. The hamstrings commonly have multiple sections of weak muscles. Tight hamstrings pull on the bottom of the pelvis at the ischial tuberosities, right here pulling, causing tension in the pelvis and the low back. Keep a very minor tension in your hamstring muscles while stretching. We always maintain a very minor tension in the muscles that we are stretching to prevent overstretching. Laying on your back, take your hands and hold the outside of your feet, pull up towards your head and pull out, and stretch. You may stretch to one side, to the left for a better left stretch, and pull towards your head and up and out to the right for a better stretch on the right, and just hang out and give the hamstrings a nice warm-up stretch, pulling forward and out. Here is the adductor stretch. As I squat here and push my elbows against my knees, I'm getting a tremendous adductor stretch. People in our chair-sitting culture have very tight adductors because we do not squat. Also, people with very tight adductors can't sit very well, Indian style. Their knees are pulled up high in the air because their adductors are so tight. The adductors are rarely weak, but are commonly found to be pathologically tight. The adductors connect the inner femur bones to the pubic bone. When the adductors are tight, they pull on the pelvis and cause pelvic instability. We start with the hamstring warm-up stretch right here and turn it into the adductor stretch by bringing the soles of our feet together and pulling our heels towards our groin and taking our elbows and pushing our knees apart, and hold for a nice sustained adductor stretch. The Piriformis Fix is a yoga stretch named Eye of Needle combined with intermittent resistance. When weak sections are present in the piriformis muscle, strong adjacent sections of the muscle tense up to compensate for the weakness, causing sciatic neuralgia by pinching on the sciatic nerve. The piriformis muscle is underneath gluteus maximus and gluteus medius. The piriformis muscle, which is right here, a relatively small muscle, joins the tailbone or sacrum to the femur. I'm going to stretch the right piriformis muscle. I cross my right leg over my left femur. I take my hands and take my right hand through the hole, through the eye of the needle, and I interclasp my hands just like this behind my left thigh. I push my right elbow into and towards my right knee as I pull my left thigh towards my body. Once I'm here, I'm going to clench my piriformis muscle here with about 20% of my strength. I'm going to tighten that up as I'm pulling for the count of 5. Clench. 1, 2, 3, 4, 5, and now I release for the count of 3. I release the clench, yet I keep the tension in this posture by pulling. As I release my clench, I maintain a minor tension here so as not to overstretch this muscle. Once again, I'm pushing my elbow that way. I'm pulling my hands this way as I clench my right buttocks for the count of 5. Clench 1, 2, 3, 4, 5. Keep pulling. Release the clench for the count of 3. 1, 2, 3. Clench right buttocks. Pull 1, 2, 3, 4, 5. Release clenching right buttocks. Keep pulling 1, 2, 3. And do it one more time. This is in a set of 3. I'm pulling towards me as I'm clenching my right buttocks. 1, 2, 3, 4, 5. Release the clench and pull. Each time the stretch goes a little deeper, I can pull a little closer to my body. Now I'm going to stretch my left piriformis. I cross my left leg over my right thigh. I take my left hand and push it through the eye of the needle and clasp my hands like this behind my right thigh. Now, my left elbow pushes into my left knee as I pull my right thigh towards my body. Once I have a nice firm stretch, I clench my left buttocks cheek, clenching my piriformis muscle with about 20% of my strength, and I pull and clench for the count of 5. 1, 2, 3, 4, 5. I continue pulling this stretch as I release the clench and count to 3. 1, 2, 3. Continue pulling this stretch, pushing my elbow into my knee, pulling my right thigh towards my body. I clench my left buttocks, piriformis again, and count to 5 while I clench with 20% of my strength. 1, 2, 3, 4, 5. I release the clench and I continue pulling this stretch for the count of 3. 1, 2, 3. This is in a set of 3. My left buttocks cheek, clenching my piriformis muscle. I pull my right thigh towards my head and push my left knee away with my left elbow, clenching 1, 2, 3, 4, 5. Relax and pull 1, 2, 3. Each time I relax and pull, I go a little bit further. Here's the pelvic fix. When the pelvis is fixated in vertical rotation, it causes leg length differences. This fix helps balance leg length discrepancies, and it also makes weaknesses in the quadratus lumborum muscles strong. The pelvic fix also makes the multifidus and transverse abdominis muscles instantly strong. Place one hand under the top pelvis on the right, one hand under the bottom pelvis on the left as you're laying down. Rest this way for 10 seconds and see how comfortable or uncomfortable it feels. Then switch hands where your right hand comes down to your bottom right pelvis, left hand comes up to your top left pelvis, and for 10 seconds evaluate how this feels. Which feels more comfortable? High right hand, low left hand, high left hand, low right hand. For me, I'm more comfortable high right hand, low left hand. Lay with the most comfortable position for up to 1 minute. This helps your pelvis unwind, stabilize, and balance. Some of our self-fixes are based in stretching. targeted stretching, especially with intermittent resistance, makes for effective and important quick cell fixes. This is the soleus stretch. I do not have a reliable muscle test for the soleus muscle. This muscle is so strong that even when it is weak, it's hard to evaluate. Remember, our first technique was soleus massage. Brace your hands on a wall or put your hands on a tabletop and do your traditional calf runner stretch, pushing your heel toward the floor. You start with your heel at least 1 inch off of the floor and push the heel toward the floor. This stretches soleus and gastrocnemius. Gastrocnemius is right here and soleus is underneath gastrocnemius. Gastrocnemius crosses your knee. So, when you bend your knee, gastrocnemius isn't being stretched anymore. This is now a isolated soleus stretch with your knee bent, weight down, pushing your heel towards the floor, pushing your hips backwards and down for a nice sustained soleus stretch, and hold it for a while, giving yourself a nice good stretch. Here is a side stretch fix. This fix targets stretching and making immediately strong the latissimus dorsi muscle and the quadratus lumborum muscle. Do not lean forward during this fix, nor lean backwards during this fix. Keep your fix directly leaning to the side. Do not cause pain. Move very slowly and be gentle. During this stretch, elongate your spine. Start with your right arm way high up in the air. Your left hand is pushing on your left hip, pushing that way. You're elongating and leaning to the left. And now give us 5 small little bounces. Watch how small I bounce. 1, 2, 3, 4, 5. And now I fold a little further over without bouncing with a count of 3. 1, 2, 3. Bounce. 1, 2, 3, 4, 5. Fold and rest. 1, 2, 3. Third set. Bounce. 1, 2, 3, 4, 5. Fold. 1, 2, 3. The entire time this hand is pushing that way. And switch sides. Bounce. 1, 2, 3, 4, 5. Fold. 1, 2, 3. Bounce. 1, 2, 3, 4, 5. And fold. 1, 2, 3. Third set. Bounce. 1, 2, 3, 4, 5. And fold. 1, 2, 3. This is the hamstrings fix. This fix targets the hamstring muscles in the back of your thigh. Biceps femoris, semimembranosus, and semitendinosus. These muscles are commonly found weak. The hamstrings fix involves stretching the hamstrings with intermittent resistance. Reach down as far as you can comfortably go and hold your ankles or hold underneath your toes. During this stretch at all times, keep your knees bent mildly and keep the pressure going into your heels. So, I'm pulling my toes with my arms. I'm pulling my body down with my arms with about 20% of my strength, and I'm tightening my hamstrings at the same time with about 20% of my strength for the count of 5. 1, 2, 3, 4, 5. And I relax, and I just pull with my arms, and I can go a little bit further. I'm keeping my weight in my heels. I'm keeping a mild tension in the hamstrings when I relax and stretch so as to be certain not to overstretch them. There are 3 sets. This is the second set. I'm pulling with my arms with about 20% of my strength. I'm tightening my hamstrings with about 20% of my strength. 1, 2, 3, 4, 5. I relax my hamstrings and continue pulling with my arms, and I fold a little further for the count of 3. 1, 2, 3. Third set, same thing. Weight into the heels. I'm pulling down with my arms, 20% of my strength. I'm tightening my hamstrings, 20% of my strength. I'm keeping my knees bent just a little bit. And I pull. 1, 2, 3, 4, 5. Rest my hamstrings and fold. 1, 2, 3. And that concludes the hamstring fix. These are the quick self-fixes for the shoulder, arm, and wrist. This is a bicipital tendon fix. This fix makes the biceps brachii long head muscle strong. This muscle is right here. Tendons connect muscles to bone. This is the bicipital tendon. This tendon connects the biceps muscle to the shoulder blade in front. This tendon goes through a groove in the humeral neck, through a groove in the humeral head. It traverses over the humeral head before it attaches to the front of the shoulder blade. On its journey, sometimes it gets fixated. When it is fixated, the biceps brachii long head muscle goes weak. The fix for this improves shoulder range of motion and helps resolve shoulder pain. It's going to look something like this. Of the arm that you're fixing, the hand is touching the thigh in front. It's going to externally rotate behind your body with the palm being up behind your body, just like that. It's going to end up behind your body. Now, the most important part of this fix is a very firm pin. Take your thumb from the opposite arm, come over the humeral head to the humeral neck with your thumb parallel to the floor, and push extremely firmly towards the opposite shoulder and hold. You're pinning a small tendon and rotating a large bone under that tendon. So, here's how it looks. My thumb comes over the humeral head to the humeral neck. Commonly, people place their thumb too high up. You come over the humeral head to the humeral neck with the thumb parallel to the floor and push extremely firmly toward the opposite shoulder. I grip my shoulder like this for stability. I have a very firm, solid pin. I flip my arm behind my body, external rotation, just like that. Firm pin, external rotation, just like that. And this movement miraculously makes the biceps brachii muscle strong. This is the elbow punch fix. This fix makes the supinator muscle strong. The supinator supinates the arm. It also makes the finger extensors strong. The finger extensors extend the fingers. These two muscles generally go weak together and become strong together. The intent of this move is to free up elbow fixations. Do not do this move if moving your arm like this causes pain. This is like a standard martial arts punch and is best done punching from your hip. Make a fist and hold your forearm and palm where your palm is facing up. With a gentle speed, punch straight forward, just like that. Your palm starts facing up, the palm ends facing down. That's it, right there, just like that at a medium speed, and that miraculously makes supinator strong and finger extensor strong. Here is the wrist fix. This fix instantly makes the opponent's muscles strong. This fix helps prevent carpal tunnel syndrome. Press your thumb firmly in the middle of your carpal arch, right there, with your thumb facing towards your middle finger, with a nice firm pressure into your palm with your thumb. Grip your wrist just like this and shake rigorously. It's 1, 2, and this fix immediately makes the opponent's muscles strong. Here is the shoulder fix. The shoulder fix makes strong teres minor, infraspinatus, subscapularis, and supraspinatus. These are the rotator cuff muscles, which are generally weak altogether and become instantly strong altogether. Teres minor is right here. Infraspinatus is right here. Supraspinatus is right here. And subscapularis is underneath the scapula, right here. Put the hand of the arm that you want to fix on the opposite shoulder. Hold the elbow of the shoulder you are fixing. You want to hold the elbow in where it stays close to your body, close to your rib cage. Using this hand, lift the arm and shoulder upwards toward the ceiling as far as it goes without pain. And now give a slight and gentle lift just like this. That was it. That makes the rotator cuff muscles instantly strong. This is the clavicle fix. The clavicle fix makes the pectoralis minor muscle instantly strong. This fix briefly stretches your clavicle's joints. The clavicle is right here. Place one hand behind your head. Bring the elbow as far backwards as it goes comfortably. Take a deep slurping breath in, and at the same time push your elbow backwards, just like this. And release, just like this. This is the elbow torque fix. The elbow torque fix and or the elbow punch fix make the supinator muscle and the finger extensors strong. Hold this arm parallel to the floor with the forearm hanging loosely. I am attempting to, with this hand, turn this palm facing outwards, further outwards. I'm turning this way. At the same time, I resist this motion, attempting to turn this hand palm in. So, because I'm holding firmly above the wrist, not on the wrist, above the wrist, this hand will not turn in. I'm going to resist for the count of 5 with about 20% of my strength, attempting to turn this hand this way. 1, 2, 3, 4, 5. Now rest. With this hand, I'm turning this palm further out. I'm turning it that way. It goes a little further now for the count of 3. No resistance. 1, 2, 3. I now repeat this procedure for a second time. This hand is turned out that way. I'm attempting to turn it this way. I am preventing that by holding here as I resist with 20% of my strength for the count of 5. 1, 2, 3, 4, 5. And now I rest again. This hand is turned this way. I'm taking this hand and I'm turning it a little further. It goes just a little further. No resistance. Yet a good firm stretch for the count of 3. 1, 2, 3. I repeat this procedure for the third and final time. This hand's turned out. I'm attempting to turn it in. This hand prevents that. 20% of my strength I resist for the count of 5. 1, 2, 3, 4, 5. Now rest. This hand turns this palm a little further out for the count of 3. No resistance. 1, 2, 3. This is the Quick Self Fix series for the torso, neck, and head. First we have the sacroiliac ligaments fix. This fix stretches ligaments that attach the sacrum to the ilium, the sacrotuberous and sacrospinous ligaments. Do not cause pain, move very slowly, and be gentle. Using the same side middle finger, pin with firm pressure the soft tissue near the bottom of your sacrum, right here. This is just above your coccyx. This is near your anus, but not in your anus. This is the location for the middles of both sacrotuberous and sacrospinous ligaments. Remember, this is a very firm contact with your middle finger. My middle finger is placed in the bellies of my sacroiliac ligaments. Firmly, I push my pelvis back into my finger and I rotate my pelvis for 5 to 7 seconds and do both sides very firmly. This fix makes the piriformis muscle strong. Using the connective tissue strap allows you to emulate the muscle strengthening effects of an assisted yoga spinal stretching routine. Now comes the very important connective tissue strap fixes. The connective tissue strap is sometimes referred to as the CT strap. The connective tissue strap routine, or an assisted yoga spinal stretching routine, makes all of the following chronically weak muscles strong as a group. Upper trapezius, scapular division medial zone, the bellies of all 3 divisions of middle trapezius, lower trapezius medial zone, the bellies of all three divisions of latissimus dorsi, the belly of the spinal division of quadratus lumborum, and the belly of psoas major. The connective tissue strap routine and the comprehensive assisted yoga stretching of the spine are master fixes and make other seemingly unrelated muscles strong. I have intensively studied assisted yoga for 21 years and spinal biomechanics for 33 years. One result of these combined studies, along with muscle testing to find and make weak muscles strong, is the connective tissue strap routine. Using the CT strap regularly makes my back feel comfortable and relaxed and may do the same for you. I recommend that you do the CT strap routine gently 2 times per day if you are working at the computer all day. Our bodies need regular connective tissue stretching to create and maintain space for blood flow, lymphatic drainage, and nerve conduction, which makes and keeps otherwise chronically weak muscles strong. When your back aches at the computer, I promise you that what you are feeling is a result of weak muscles. The sections of adjacent muscles, which are strong, are being dramatically overused and abused in an attempt to compensate for these weak muscles. If you have any musculoskeletal symptoms or a previous medical diagnosis concerning your spine, ask your medical doctor, osteopath, or chiropractor if the connective tissue strap is safe for you. For instance, disc herniations may be made worse by using the connective tissue strap. It is very important that you do not use the CT strap where there is pain or cause pain using the CT strap. Using any more than a gentle force is not safe and may cause harm. Remember, by gently using the CT strap daily, over time, the connective tissue associated with your spine will become relaxed in a sustainable way. I have conclusively proven that gently using the connective tissue strap makes and keeps targeted chronically weak muscles strong. Resist the urge to use more than a gentle force. Also, only use a connective tissue strap exactly as I instruct or you may cause harm. There is no need to experiment with the CT strap on your spine. I have already done that for you. Focus on holding each stretch between 5 and 8 seconds. Older people may need to stretch for 8 seconds, while younger people may need to stretch for 5 seconds. It really depends on your current flexibility, not necessarily your age. This is my friend Christy. Thank you for helping me, Christy.
It's my pleasure.
Please have a seat right here. In assisted yoga and yoga, when connective tissues relax, the body moves a little bit. So, I'm going to stretch Christy to the side here. Let your body go all the way to the side. There we go. And I'm waiting for her body to relax, and there it went. When it went, I moved a little bit with her, following her into her lean. It's a very subtle body movement. As connective tissues relax, it can be seen in the mirror. So, when you are practicing with your connective tissue strap, start practicing in the mirror, watching for the connective tissue release so that you know when the technique has completed. Here we go. I'm waiting for the release. I'm waiting. There it went. We moved, yet ever so slightly. Same concept here. I'm torquing Christy's spine, pushing up on her spine, and I'm torquing her and I'm waiting. And there it went. Her body moved and gave just a little bit deeper into the torque. Torquing Christy's upper body. I'm waiting for the movement, and I'm waiting. There it went. It's very subtle, very slight, yet it is certainly there. And now for the connective tissue strap routine. At first, working with the connective tissue strap will be awkward. Soon, with repetition, it will feel as normal as brushing your teeth. By itself, this connective tissue strap section is an awesome addition to any yoga workout. This is micro-stretching of your spinal connective tissue using the CT strap to reach places you cannot reach and stretch yourself. In very simple terms, using the CT strap along the spine is like playing tug of war with your spinal connective tissue. It's all about creating opposing forces for pulling specific connective tissue apart, creating and sustaining gentle yet firm stretches. The CT strap procedures are part of the Quick Self Fixes routine, where we put all of the Quick Self Fix techniques together into a 15 to 20 minute routine. For now, review these connective tissue strap procedures repeatedly until you have learned them well. Otherwise, you will not be able to keep up during the Quick Self Fixes routine, which moves at a relatively rapid pace. You may order a connective tissue strap from me, see www.quickselffixes.com, or call 404-808-4280, or you can easily make your own. This is how to make a connective tissue strap. The connective tissue strap is also referred to as the CT strap. This is how to make two connective tissue straps, one from a beach towel and one from a sheet. Find the longest beach towel that you can find and cut a 6-inch swath in it. Wind the beach towel up starting in the center, making a rope. The secret to a good strap is to have it super tight. Use your foot as a brace. Now, tie a loop in the center of the strap. Focus on keeping the knot in the center of your strap and tighten it up. Tighten it up super tight. There. This is my preferred connective tissue strap for using in the shower. The heat from the hot water on my back makes for a better stretch. I hang it over the shower head, and I'm in the shower looking at it, and I use it almost every day. Here's how to make a connective tissue strap from a sheet. Take a top sheet and cut a 2-foot swath in it. Now, wind it up, starting in the center. Wind it up as tight as you can. Use your foot as a brace. My protege, Greg Tinkle, who teaches yoga, helped me figure out how to make a new and improved connective tissue strap, and that's what we have here. Thank you, Greg. Once wound up tight, make a standard loop. Now, the piece that comes out from above goes under and through, and the piece that comes out from under goes over and through. Tighten it up, focusing on keeping the knot in the middle. Tighten it up as tight as you can. And here you have one of the greatest inventions of the 21st century. Top sheets have different thread counts. If it's a heavier thread count, a thicker sheet, your length may be less. If the thread count is less and it's a thinner sheet, you may need a longer piece. Play with it. Create a knot about the size of a large chicken egg. You are welcome to purchase connective tissue straps from us at quickselffixes.com or happily make your own. First is a connective tissue strap procedure for the low back connective tissue. This technique stretches connective tissue in the low back, focusing on stretching the thick connective tissue called the lumbar aponeurosis. The lumbar aponeurosis is just underneath your skin and it covers your entire low back area. It is thick and tough, just like leather. Restrictive tightness in this connective tissue is the most common cause of low back discomfort. When you use the CT strap, always move very slowly and be gentle. Do not cause any pain. Moving slowly and gently creates safety. We will perform this procedure 3 times in the low back, starting in the middle of the low back. Place a connective tissue strap ball, or not, in the middle of your low back between the top of your tailbone and the bottom of your rib cage. There's the top of the tailbone, here's the bottom of the rib cage. The ball placement goes right in the middle. The lamina grooves are on either side of the absolute middle of your entire spine and are actual grooves. Here are the lamina grooves. The ball placement goes just next to the very center of the midline and a little bit to the right, still on the spine. On my body, here's the bottom of my rib cage, there's the top of my tailbone. The ball goes between those 2 points. From the absolute midline of my spine, I go a little bit to the right into the lamina groove. There's your ball placement. People often place the ball too far to the side. Correct ball placement is essential. Stand with your feet shoulder width apart. Bring the 2 ends of the strap forward around your waist, inside your arms, and hold with both hands. Anchor the left CT strap by pulling it across the front of your abdomen parallel to the floor, keeping it at the same level with the ball on your spine. You've set your pin, now let's stretch against it. Pull the right CT strap away from the body parallel to the floor and diagonally to the right. You are not pulling the CT strap to the front. You are not pulling the CT strap to the side. You are pulling it diagonally, exactly between pulling to the front and pulling to the side. Next, lean to the right from the CT strap ball as you continue pulling firmly on your right CT strap diagonally away from your body. Pulling firmly does not mean pulling hard. Now, increase this lean a little by pushing your low back at the CT strap ball to the left as you bear more weight on your right foot. Keep pulling the CT strap right. Now, really elongate your spine by stretching upwards toward the ceiling. Lean backwards just a little bit to increase your stretch. Breathe and hold this stretch for 5 to 8 seconds as you focus on stretching this thick leather-like connective tissue over your low back. Pulling your right CT strap diagonally to the right and pushing your low back to the left creates an opposing force, giving the low back connective tissue a very specific stretch. This is analogous to playing tug of war with a thick leather-like covering over your low back. Here is the same procedure for the other side of your low back. Shift the ball over the midline of your spine. Move the ball just to the left of the absolute center of your spine. Here we go. From the right lamina groove, there's the midline of my spine, there's my left lamina groove. Remember, the lamina grooves are on both sides of the absolute center midline of your spine. People often place the ball too far to the side. Stand with your feet shoulder width apart. Anchor the right CT strap by pulling it across the front of your abdomen parallel to the floor, keeping it at the same level with the ball on your spine. You've set your pin, now let's stretch against it. Pull the left CT strap away from the body, parallel to the floor, and diagonally to the left. Remember, you are not pulling the CT strap to the front. You are not pulling the CT strap to the side. You are pulling it diagonally. Lean to the left from the CT strap ball as you continue pulling firmly on your left CT strap diagonally away from your body. Increase this lean a little bit by pushing your low back at the CT strap ball to the right as you bear more weight to your left foot. Now, really elongate your spine by stretching your spine upwards and lean backwards just a little bit to increase your stretch. Hold this stretch for 5 to 8 seconds as you focus on stretching this thick leather-like covering over your low back. Replay this procedure twice more, performing it on the right and left, first at the bottom of your low back, just above your tailbone, and second at the top of your low back, just underneath your rib cage. You will repeat it here, and here, and here, and here. This completes the connective tissue strap for the low back connective tissue. This is the connective tissue strap procedure for the lower 20 rib ligaments. This technique stretches connective tissue along the spine, focusing on stretching ligaments which tie the ribs to the spine. Ligaments are tough, slightly flexible straps which connect bone to bone. Ribs are not fused to the spine. They have actual movable joints connected together with ligaments. Find the bottom of your rib cage and follow it to where it meets your spine. Place your connective tissue strap ball right above the bottom of your rib cage, just to the right of the very center of your spine. Stand with your feet shoulder width apart. Place the connective tissue straps on the outside of your arms, just above your elbows. Anchor the left connective tissue strap by pulling it across the front of your body parallel to the floor. This must be a gentle pin. If this pin is too tight, this technique does not work. You set your pin, now let's stretch against it. Pull the right connective tissue strap diagonally to the right. From the connective tissue strap ball, lean your upper body to the right. Increase this lean by pushing your spine at the connective tissue strap ball to the left as you bear more weight on your right foot. Release a little more tension in your left connective strap now. Elongate your spine upwards. Keeping a firm tension in your right connective tissue strap, pull the right strap diagonally up and hold. Now, mildly rotate your torso left by pulling your right connective tissue strap gently forward and to the left. Lean backwards just a little bit to increase your stretch. Breathe deeply several times. Hold this stretch for 5 to 8 seconds. Focus on tractioning the ribs away from your spine. Pulling your right connective tissue strap diagonally to the right and pushing your lower rib cage at the connective tissue strap ball to the left creates an opposing force that gives your rib ligaments an awesome and safe stretch. Here is the same procedure for the other side of your lower rib cage. Shift the ball over the midline of your spine into the left lamina groove, placing the ball just to the left of the absolute center of your spine. Here's the ball in my right lamina groove. I'm passing it over the center of my spine into the left lamina groove. Stand with your feet shoulder width apart. The connective tissue straps are on the outside of your arms just above the elbows. Anchor the right connective tissue strap to your body by pulling it across the front of your body parallel to the floor. You've set your pin, now let's stretch against it. Pull the left connective tissue strap diagonally to the left. From the CT strap ball, lean your upper body to the left. Increase this lean a little by pushing your spine at the ball to the right as you bear more weight on your left foot. Release a little more tension in your right connective tissue strap. Now, elongate your spine upwards. Keeping a firm tension in your left CT strap, continue pulling it to the left and diagonally. Now pull it up towards the sky. Rotate your torso to the right by pulling your left strap gently forwards and to the right. Lean backwards just a little bit to increase your stretch. Breathe deeply several times. And hold this stretch for 5 to 8 seconds as you focus on pulling the ribs away from your spine. You may perform this procedure at multiple levels going up your rib cage. This completes the connective tissue strap routine for the 20 lower rib ligaments. Here is a connective tissue strap procedure for upper rib ligaments and for neck ligaments. This technique stretches connective tissue along the spine, focusing on stretching the ligaments that tie 2 ribs to the spine at the second thoracic vertebrae. It also provides significant connective tissue stretching for neck ligaments and a thick leather-like covering over the side of the neck. Again, I remind you to always move very slowly, be gentle, and do not cause any pain. Place the CT strap ball in the right lamina groove of your upper back. Depending on the length of your spine, this may vary between 2 and 4 inches below the very top of your shoulder. For me, it's about 3 inches down from the top of my shoulder. The ball is placed right next to the center of the spine in the right lamina groove. Get that placement. It's very important. Now, stand with your feet shoulder width apart. Place the left connective tissue strap below your left armpit and anchor it by pulling the strap across your chest. You've set your pin. Now let's do the stretch against it. Pull the right CT strap diagonally up. Now pull the right connective tissue strap diagonally to the right. Turn your head to the right with your nose pointing toward the right connective tissue strap and keep it there. Now, elongate your neck by lifting your head toward the sky and lean your neck to the left by leaning your left ear towards your left shoulder as comfortably as it goes with the weight of your head. So here's the stretch. And hold for 5 to 8 seconds. These actions together create an opposing force that gently and safely stretch the associated connective tissue. Here is the same procedure for the other side of your upper back. Switch the CT strap to the opposite shoulder. Place the CT strap ball in the left lamina groove of your upper back, 2 to 4 inches below the top of your shoulder. Right here, very close to the center of your spine in the left lamina groove. Get that ball placement, it's very important. Stand with your feet shoulder width apart. Place the right CT strap below your right armpit and anchor it by pulling the strap across your chest. You've set your pin, now let's stretch against it. Pull the left CT strap diagonally up. And now pull your left CT strap diagonally to the left. Turn your head to the left with your nose pointing toward the left CT strap and keep it there. Now, elongate your neck up by lifting your head toward the sky and lean your neck to the right by leaning your right ear towards your right shoulder as comfortably as it goes with the weight of your head. Continue to elongate your neck, continue tension in your left CT strap, maintain this firm tension, and enjoy this awesome stretch for 5 to 8 seconds. This is the connective tissue strap procedure for the low back. This technique stretches connective tissue, focusing on stretching the ligaments that tie the vertebrae to each other. This procedure also focuses on stretching the intervertebral discs. Discs are spongy cartilage pads between most vertebrae. This procedure is performed 3 times, starting from the very bottom of your spine. Always move very slowly, be gentle, and do not cause any pain. To begin with, place the CT strap ball at the very bottom of your spine, just next to the very center of your spine on the right, in the right lamina groove. Ball placement is very important. Right next to the very center of your spine, a little bit to the right, in your very low back. Stand with your feet shoulder width apart. Place the CT strap inside your forearms and elbows on the left and right, and hold the straps with both hands out in front. Anchor the left strap by pulling it across the front of your abdomen parallel to the floor. You set your pin. Now let's stretch against it. Pull the right strap firmly out in front of your body and then straight up. It should be in line with your ear. It must be a very firm pulling here. Lean forwards from your waist up to 90 degrees, keeping tension in the right strap. Now, lean your upper torso to the left by pulling your right strap forward and to the left. And hold for 5 to 8 seconds, enjoying this deep low back tractioning stretch. When you come out of this stretch, come back to the midline for safety reasons, and then come up. These actions create an opposing force, stretching connective tissue in your low back by pulling the spine away from your pelvis. Here is the same procedure on the other side of your low back. Shift the ball over the center midline of the spine at the very bottom of your low back, going from the right lamina groove across the midline to the left lamina groove. Get that ball placement, it's very important. Anchor the right CT strap by pulling it across the front of your abdomen parallel to the floor. You've set your pin. Now let's stretch against it. Pull the left strap firmly out in front of your body and then straight up. It should be in line with your ear. Now, lean forward from your waist up to 90 degrees, keeping tension on the left connective tissue strap. Pull the left strap forward and to the right as you lean to the right, and hold for 5 to 8 seconds, enjoying this awesome low back tractioning stretch. As you come out of this stretch, come back to the midline for safety reasons, and then come up. Replay this procedure at 2 more spinal levels. First, in the middle of your low back, between the bottom of your spine and the bottom of your rib cage, right here. On my body, in the middle of my low back, on the right and the left. Second, just below my rib cage, on the right and the left. The connective tissue strap routine will only be learned through multiple repetitions. Have perseverance, and you will succeed. This concludes the connective tissue strap routine. Here are the guided neck stretch fixes. Take your connective tissue strap, place the ball on the top of your shoulder, hold each end of the strap, and pull toward the floor. This is cervical rotation, turning my head to the opposite side with cervical extension, pushing my head and neck backwards. Turn my head to the side and extend backwards, always elongating my neck. I take this hand and hold my frontal bone and temporal bone, and I pull to elongate, and I hold for 5 to 7 seconds. Here is straight cervical lateral flexion, bending my head to the side. This arm is pulling down, pulling this strap taut, keeping pressure on this shoulder, pulling down. I lean my head straight to the side, not forwards or backwards. At the very end, I take my hand and I pull up and over and hold for 5 to 7 seconds. And switch sides. Cervical rotation with cervical extension. I turn my head, extend my head backwards. I take this hand and I pull up to elongate my neck and pull backwards and hold for 5 to 7 seconds, relaxing into the stretch. The whole time, this hand is pulling down. Now comes cervical lateral flexion, leaning my head straight to the side, elongate my neck, lean to the side, and pull to elongate my neck and hold for 5 to 7 seconds. Now we have cervical extension. I'm going to hold my head not under my jaws. I'm going to hold behind my ears on my occiput and traction my head all the way up, tractioning my neck, and lean backwards and hold for 5 to 7 seconds. And now for cervical flexion, which is leaning forward, I hold my occiput not under my jaw. I traction my neck straight up and bring it forward, chin towards chest, and hold 5 to 7 seconds. Here is the occiput glide fix. This fix involves 3 distinct motions. One is my head's bobbing up and down. The other is my head is turning from the far side to the midline. And the third motion is I take my middle finger and I place my index finger and ring finger on it, just like that, for support. I place my index finger behind my ear, below my ear, just behind the mastoid process, which is a bony knot right there, and I drag that finger all the way to the midline. So all 3 motions at the same time. My head's bobbing up and down. My head's turning toward the midline as I drag my index finger to the midline just underneath the base of my skull. And now for the other side, same finger configuration, just behind the ear, below the mastoid process, that marble-sized bony knot right there. My head's turned all the way to the side. I'm bobbing my head up and down. I'm turning my head toward the midline, and I'm firmly dragging my index finger from the side to the midline, stretching thick connective tissue between the base of my skull and the top of my spine. Here is the cranial fix. Take your little finger, place it on your frontal bone. Take your ring finger, place it on your sphenoid. Take your middle finger, place it on your parietal bone. Take your index finger and place it on your temporal bone. Place your thumbs on your occiput and hold extremely light and extremely gentle. It's okay if the finger placement is not exactly perfect. This fix works anyway. Hold very gently, very tangentially, very softly. Now that you have studied and learned all of the quick self-fixes, here is where we put them all together in the quick self-fixes routine. Proper hand placement must be determined prior to doing the pelvic fix during the following quick self-fixes routine. Review the pelvic fix on this video and study the pelvic fix in the accompanying quick self-fixes book. I invite you to join our Strong Club by learning the Quick Self Fixes routine and practicing it daily.
Hello, my name is Dr. Shawn Amina Murray. I am an osteopathic physician, board certified in osteopathic manipulative therapy and neuromusculoskeletal medicine. I am very grateful to share with you today about my experiences using Dr. Cassius Camden Clay's quick self-fixes and explain technology of how they work to support your optimum health and vitality. Personally, I suffered from chronic hip pain and lower back pain generated from pelvic imbalances of my hips and sacrum and the stiffening of the aging process. I felt pain while sitting, walking, and sleeping. By getting body adjustment work, my pain would remit for almost a week. For 7 years, I've been in pursuit of preventing the need to have hip surgeries for arthritis that was developing in my hips, created from my genetics and multiple impacts on my hips and ankles from the gymnastics of my youth, which led to chronic structural misalignments. After removing food allergies from my diet, taking appropriate nutritional supplements, my pain reduced to about half. I was still waking up at night in pain, and even when I would get up in the middle of the night to do yoga stretches, I still felt stiff and had pain with walking. When I started regularly doing the quick self-fixes routine in the morning, before I proceeded to my fitness workout, I became pain-free. A couple of times, the back pain would come back during long hikes or long periods of standing or driving, and I would just do a few quick self-fixes, and in a minute, my gait corrected, and my pain would vanish. Why do quick self-fixes work? Osteopathic medicine has demonstrated that normal musculoskeletal structure is essential for normal function of the whole body. The musculoskeletal system includes muscles, ligaments, tendons, bones, and fascia. If we take out all bones, muscles, skin, and organs in the body would retain its shape due to the all-encompassing presence of the fascia. The fascia contains within it all nerves, blood vessels, and lymphatic channels that nourish the tissue, remove metabolic waste, and harmoniously synchronize the body's function as a unit. Alignment of the musculoskeletal system supports healthy posture, gait, nervous system balance, metabolic, immune, and endocrine function, circulation of the body fluids, and behavior adaptation. This helps a person to more effectively respond to environmental stressors such as trauma, infection, social stress, and toxins. Quick self-fixes allow you to improve your musculoskeletal alignment and maintain it through your self-stretching your peripheral joints. Dr. Kareem Semhori, a neurometabolic fitness and rehab expert, said, "If an exercise creates muscle imbalances, this can lead to joint deterioration all over your body and even blunt fat loss." You see, once your joints are out of position, your body has subsensory pain signals taking place all over the body. These pain signals tell your brain to shut down the muscles in the area in order to avoid pulling on the injury and causing more damage. The end result, no muscle contraction and weaker muscles. By reducing joint fixations, the muscles around the joints turn back on. That is why, when you muscle test before and after a quick self-fix, it appears miraculous that the muscle instantly becomes strong. This is why it is important to do the quick self-fixes before your workouts or as you start your day. If your muscles are turned off, say on one side of your body more than the other, when you lift weights, run, or sit for long periods of time at your desk, you will have to use muscles that are turned on to compensate for those muscles that are turned off. And you can create pain due to building muscle strength on one side of your body over the other. You can also lock in spinal misalignments that can adversely affect your entire body as well. Many of my clients experience pain relief when the joint fixations are resolved and their muscles become strong, which leads them to exclaim, "That's amazing." I, like my clients, feel gratitude for something so easy to do, which is so highly effective in eliminating pain, increasing strength and performance, and preventing injury. The second major aspect to quick self-fixes is stretching the ligaments and fascia along the spine and major muscle groups that significantly affect your posture. Osteopathic physicians attempt to obtain spinal alignment via Dr. Still's methods of getting the joint to a point of release without jerking the bone by gentle exaggeration of the joint in the direction of ease via ligament stretching. This allows the ligaments, not the muscles, to return the bones to their normal relations and positions. which helps alleviate nerve impingement pain and turns weak postural and extremity muscles strong. The connective tissue strap works similarly by gently stretching the connective tissue to regain better spinal alignment, decrease nerve impingement, and make weak muscles strong. The importance of using the Quick Self-Fix's connective tissue strap to stretch the fascia along the spine is due to the fact that this fascia contains the major relay tracts for your autonomic nervous system, which innervates your blood vessels and organs, and your peripheral somatic nervous system, which innervates your muscle, joints, and skin. These two primary nervous systems interact via reflex arcs within the spinal cord, which allows dysfunction in organs to weaken your muscles and misaligned muscles and joints to weaken your organs' functions. The sympathetic nervous system, which is your fight or flight nervous stress response part of your autonomic nervous system, has nerve tracts that run anterior to the rib heads and anterior lateral to the lumbar vertebrae, which is where the connective tissue strap stretching techniques primarily focus. Fascial tension along the spine thus can adversely affect muscle strength, organ function, your ability to respond to stress, and your vitality. By keeping this fascia free of constrictions every day using the connective tissue strap, promotes strength, balance, optimum athletic performance, and healthy adaptation to stress. I have used the Quick Self-Fixes with my clients, and each time they comment, "That's amazing," or "Oh my God," they often receive immediate relief from the Quick Self-Fixes even if their pain has been in play for many years, as long as they do not have underlying food allergies, toxins, or significant metabolic issues such as cancer or autoimmune processes, or structural trauma from major accidents or surgeries. I recommend that prior to using the Quick Self-Fixes, you check with your medical doctor to determine if the use of the Quick Self-Fixes is safe for you by ruling out any possible medical conditions that may adversely affect your bone density or joint integrity.
I discovered subtle muscle testing and quick fixes about 4 years ago when I went to see Dr. Clay due to years of knee pain. Someone had referred me to him telling me that he was good at figuring out strange problems. I had been unable to run for 2 years and been to every conventional doctor you could think of, with no luck. Dr. Clay did this funny little test and told me that my knee was out of place. He taught me a self-adjustment and then he told me to go run. I was skeptical until I went for a run later that day and it worked. After that, I was hooked. I started studying this work with Dr. Clay and his wife, Dr. Sean Murray, and began putting what I learned into practice at my job as a personal trainer. I've been in the fitness industry for 8 years. I'm constantly around people with aches and pains from using their bodies. After studying this work for only a month or so, I fell in love with it, even more when I learned that it is work that literally anyone can do. I wanted to learn it for myself so I could teach my clients how to stay strong, so they would be able to attain their fitness goals and be free of nagging aches and pains. I now have created a niche for myself in the marketplace as a personal trainer who knows these miracle quick fixes. The people I have taught these tricks to have benefited so very much that it makes me excited to show everyone I come in contact with. To go along with that thought, I also have a newfound love in CrossFit. CrossFit is a fairly new kind of fitness training that focuses on constantly varied workouts, functional movements, and high intensity. These quick fix techniques have been a lifesaver for me, as well as my fellow CrossFitters who are always asking me for the latest and greatest information on quick fixes, because we're constantly pushing our bodies beyond limits that we knew were possible. This work is a must for any athlete or for anyone who uses their body, period.
What makes Camden Clay's Quick Self-Fixes important? The answer in a nutshell is to enable, to enhance, and to empower. Hi, my name is Barbara Sharp, and I'm a licensed massage therapist in the state of Georgia. I started working with Camden Clay in 2007, and I'm an original graduate of his training program in subtle muscle testing and quick self-fixes. How do quick self-fixes enable? Well, quick self-fixes live up to their name. These techniques were developed in order to reactivate muscle weaknesses. When your muscles are weak, you tend to have more problems doing your everyday tasks, whether that is in work, sports, or just living. I use these fixes on myself, my family, and my clients to enable the body into comfort. For example, my teenage daughter has loose ligaments in her knees and ankles, and she feels discomfort when she stands or walks for a long time. A hip and leg routine 2 minutes long will enable her to resume walking or standing with new strength. In another example, I might feel my arm weakening while doing my massage work. A quick arm routine of 3 fixes will renew my strength and reduce or eliminate pain, thus enabling me to continue performing a good massage for my client. Quick self-fixes enable me to take care of small problems before they become big, painful problems. How do quick self-fixes enhance? As a lifelong learner, I really enjoy learning new applications that I can immediately use for myself, my family, and my clients. It enhances my massage practice because it makes me a more effective therapist for existing clients, and it's a great marketing tool to gather new clients with. People are amazed and intrigued by the new strength they feel in their bodies, and they're also impressed by how quickly I can assess and make that change happen. Doing a full routine of quick self-fixes on myself sets me up to work a strenuous, active day. It actually gives me better stamina and even clarity of mind. I believe that this is because there are fewer inactivated areas that roadblock a healthy energy flow. Quick self-fixes also enhance performance. When you feel better, you perform every task better. And physically, even when your conscious brain may not be aware of a weakness, your body is. It makes sense, and it has been tested, that when you can activate all the muscle fibers, you gain strength, control, and precision. One of my clients said, "I could lift more weight with less pain." Well, quick self-fixes don't replace training and practice, but muscle testing and quick self-fixes can enhance the functional performance potential in any activity, be it sport-related, work-related, or life-related. How do quick self-fixes empower? A lot of clients come to me because they hurt. They're looking for a solution to their physical pain. Camden Clay's muscle testing techniques empower my skill in assessing where and what the problem is within the scope of my practice. As a massage professional, I really enjoy seeing my clients' amazed reactions that something so seemingly simple can produce such a big change for them. Muscle testing and quick self-fixes are powerful assets in a massage treatment. The top massage research is focusing more and more on the importance of making space within the body for the healing flow of blood, fluid, lymph, and energy throughout the fascia matrix that is your body. Quick self-fixes help achieve that. But here's the biggest idea. Teaching others how they can create this positive change for themselves is the ultimate empowerment. No one gets well without their own active involvement in the process. Life is not static. Empower yourself to manage it. Whether you're watching this DVD to enable your body out of pain and into health, or enhance your ability to perform at a higher level, or to help people you professionally treat, or just your friends and family, you will find that knowing these techniques, which you can apply anytime and anywhere, is one of the best empowerments you will learn for your life. Enable, enhance, and empower. Now that's amazing.
Start learning how to muscle test, find weak muscles, and make them instantly strong using quick self-fixes. This free course includes a 30-minute video and 16-page companion book. This course focuses on 5 major muscles that move and stabilize the shoulder joint. These muscles are commonly found chronically weak in adults on one or both sides of the body. Learn 5 easy muscle tests to quickly assess these muscles and 5 corresponding quick self-fixes that make the weak muscles found instantly strong. This is amazing muscle testing fun. Go to quickselffixes.com.